pain.
But speaking about pain, so
Something that we see a lot. right?
and something we deal with personally a lot, especially when we train.
Much.
But today's episode, guys, we are going to be talking about pain, a bit about good pain, a bit about bad pain. So DOMS, or delayed onset muscle soreness, versus actual injury versus just being in fear when training. How to train around it, how to train through it, when's the right time to pull back, when's the right time to keep going, when's the right time to see out to a physician, potentially get imaging done. I know Josh isn't a massive fan of imaging, but we'll explain the reason why in the episode. So at some point, everybody has trained through pain. Everyone has also stopped training because of pain. So it can mean different things to different people. Obviously, people have different pain thresholds and whatnot. So let's get started on today.
Like I've just pulled it up. It's like literally like from the Association on Pain.
Yeah,
like I think that's the important thing is to actually define it. Like what is pain?
All right, go.
All right, so from the International Association for the Study of Pain. All right, pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage.
Yep.
A lot of words.
Stupid,
be confusing definition. But what it describes is that it's an unpleasant sensory and emotional experience.
Yep.
That may or may not exist with or without tissue damage.
Yeah. Well, and even off the back of that, I'm sure there's plenty of people or listeners out there that can say that they may have had some sort of soft tissue injury, a pull, a strain, a tear, whatnot, and months after that area had recovered, still showing signs of pain. Obviously, there is no more soft tissue damage, but there can be pain. I can speak from personal experience the first time I hurt my back deadlifting. Okay? Months after, I could not deadlift past 100 kilos without having that pain. 100 kilos at the time was the first real number where it was like, okay, I need to focus a little bit more. I need to brace a bit harder. I need to actually think about what I'm doing. 95 kilos, no pain. 100 kilos, pain. And I tested it. I would go between 95 and 100 kilos. And at 95 kilos, I'd feel fine. I could do reps, no drama. As soon as I got to the 100 kilo mark, it was that I don't know whether it was the number in my head or whatnot, but my back would start hurting.
And there's the sensory and emotional side.
Exactly, right?
Huh?
So I think when it comes to actually training around and through pain, there's so many different things that we can do.
I think one of the general rules of thumb for me with my clients in particular, if they're coming in and they're training with me or they're, come in with an injury, whatever the case may be, is like, depending what their start pain is, like when it's like at their worst, like what is that pain on a scale of 1 to 10, right? And then, we retest some stuff, we treat some stuff. Where's it sitting? Okay, cool. The general rule of thumb that I'd go with is I can be a little bit more aggressive with some people if they're really wanting to push it, they're really competitive, and go like, right, if it's under a 5 out of 10 pain, I'm okay. Like I'm fairly confident with most people, especially if they've got a good training age, that they're not gonna, go and screw themselves up more.
Yeah.
On the off chance that there is something more tissue related involved. For others, sort of under 4 out of 10 is generally fairly well accepted. Sub 4 out of 10 pain. Okay, like we're going more towards that low end of the scale where it's potentially a little bit more of like a discomfort or an ache, rather than a genuine like painful experience.
Yeah. And on that, like the emotional side of things can be really tough too, because you can have someone, and I don't know if you've ever seen this, but you can have someone that comes into the clinic and they say, hey, my ankle hurts. Oh, what's the pain out of 10? It's like 8 out of 10, but you just watch them walk in
with no limp
to the clinic, right? And it's like, okay, what's your actual pain threshold? Whereas
pain's relative,
right? Whereas if you have someone that's been in potentially chronic pain their entire life, how's your back feel? It's like, yeah, it's all right.
Yeah,
I'm used to it. But it's like they could have some serious damage, or potentially they could be in a lot of pain, but it's like they just come to live with it. So it's like, okay, the pain threshold might for them be a 5, where it's like, no, we need to do a lot of work on you.
100%. But I think like on that note as well, like one thing that I've seen a lot recently is mothers, like if they have particularly rough pregnancies, for whatever reason, their perception of pain just disappears.
Well,
like I've seen, like I'm treating a woman at the moment who's got like a pretty gnarly like like neck, like upper back issue and like nerve related stuff. Oh yeah, it's 2 out of 10. Can't feel my hand, but it's 2 out of 10.
Yeah.
I'm like,
Well,
sorry?
They actually did a study on this where they wanted to see which group of people had the highest pain threshold,
Mm.
and mothers or women that had given birth was the group that was at the highest.
Yeah. We're soft.
We are compared to them.
We're horrible. I've seen
What?
you limp in, unable to move, carry on like an absolute pork chop.
Thanks.
You've seen me limp into the gym, carry on like an absolute pork chop. Like it is what it is. But I think like this is the key point, right? Like this is we are like it is still a bad pain, right? Because it's relative to each person. Like
Yeah.
I'm not here as a physio, like trying to like preach to them about like, oh well, you know, this is an emotional experience. Like it's real for you.
Yeah.
Like I'm not going to gaslight them into believing that it's all in their head. Like at uni, we're taught like so much about the perception of pain that they actually, certainly when I was going through, they almost shied away from addressing the tissue side of it. Now, that's not saying that we're going to cure the tissue structure or anything like that, like massage and dry needling, whatever the case may be. Those interventions aren't breaking up scar tissue.
No.
They're not.
Yeah.
But they are altering the nervous system and the brain's perception of that area, of that site. I needle your calf when you like, and around your calf when you have a calf strain. It doesn't fix your calf,
No.
but does it?
Pain goes away.
The pain goes away. Might distract you with another pain, but
Yeah.
you know, it does assist in those processes.
Yeah.
And the same thing's true with like a back injury or something like that.
Yeah.
So I think for me, like it's not about training around or training through pain. It's about making sure that we understand what is going on with that pain and we understand that experience, and that I help people understand what that experience is so that they can make a decision and an educated decision for themselves. Because I'm not here to force you to keep training. If you don't want to train, fine. If
That's
you want,
on you at the end of the day.
it's on you. Exactly right. I'll work with it, but we may change our timelines for a return to
Yeah.
100%.
Yeah. And I think for me, being in the gym environment, obviously when someone comes to me with pain, it's like, okay, how are we going to modify this potential session? Now, I have seen more so for people that don't have a coach or they're not seeing a physio when it comes to pain, some of the main reasons why they'll just continually train through their pain, often it can be driven by their ego.
Yep.
Because they just like, they got to stick to the program, or they just want to show how tough they are, or it's like they don't know any other way. So hopefully, if you are one of those people that don't know what to do when you're in pain, hopefully you can get something out of this. The fear of losing progress. So they may have been on a training split and they're progressing really well, and it's like now all of a sudden they're feeling pain in their shoulder. It's like, I just got to keep pushing through because I don't want to go backwards.
Yeah.
Not realizing that sometimes taking 2 steps back can help you take 5 steps forward.
Yeah.
That could be one of those things which we can talk about.
Yeah.
And also just like the no pain, no gain. Like
I can't.
I can understand like training hard and like pushing yourself to your limits, 100%. Like if you want to make, you know, substantial progress, then yeah, training hard is key. But that feels very different to training through sharp pain in your shoulder, or a lower back that can't flex, or knees that feel like they're going to pop every time you bend them. Like there's a difference between those two things.
Yeah, there's a difference between training with intensity and training
Training hurt. Yeah.
all the time, or training injured.
Yeah.
And one of them you're going to see progress over time. One of them you're going to see a regression over time.
Yeah.
And you are going to see it.
Yeah.
And like, you know, like I'm not sitting here, no, I'm sure you're not either. Like sometimes we all have bad sessions. We all have a session where we walk in and we're like, holy crap, everything hurts. Like my knee hurts, my back hurts, my ankle hurts, like my little finger hurts. Right? But like, that doesn't mean that I'm injured in all of those places actively. Right? Because if I can warm up through it, I can move through it, I can do like some activation stuff. Okay, we're good. Like maybe not for the little finger, but you know, we're good. It's not, it takes a long time to actually lose gains, like genuinely lose your gains if you're well trained. If you're well trained, like, yeah, okay, like you'll feel flatter, you'll feel more deflated. The worst for this, the worst culprits are the boys that are on gear. If they're mid-cycle or they're blasting and they come in pain, they're just going to keep training.
100%.
They're going to keep going because like, oh man, halfway through a blast, like I need to capitalize on this.
Keep going.
I've only got like 2-3 more weeks, like, you know, whatever. It's like, okay, but like if you tear your pec, we're gonna have problems.
We're gonna have even longer problems,
Yeah.
bigger problems, yeah. But that's why, like, if you've got any of those things, like you've got the sharpness of pain in joints when you're doing any type of movement, and no amount of warming up can fix it. If your pain is progressively getting worse each session, or you have to drastically modify how you're doing the lift to accomplish it, that training through pain is not going to lead you anywhere good.
Yeah.
So one thing that you can do, so this is where the training around pain can come in. So you can modify your training without stopping completely by adjusting your load.
Mhm.
So maybe, you've got shoulder pain, or like me, for example, when I was using that deadlift, for example, it's like if I just focused on maybe deadlifting slightly lighter with maybe slightly different tempos, or adding more sets and reps to that lift, it may have shown a progression later down the track than just going, okay, I'm just not going to deadlift completely. Changing your range of motion. If you're, let's say, for example, bench pressing, and when the bar touches your chest, you have a sharp pain, you move to floor pressing and the pain goes.
Mm.
Maybe that could be an adjustment. Exercise selection, again, maybe changing the machine. Your more stability, more external stability using a machine versus a free weight.
Mm-hmm.
Maybe the pain diminishes. Maybe the pain goes away completely. And then volume and intensity. Maybe one set is good enough versus 5.
Yeah, I think with loading, like one of the things that I play with a lot with a lot of my gym goers who come in is, say they want to train in like a 6 to 8 rep range, right? And that's their ideal. We might double their rep range. We might go 12 to 15.
Yeah.
With that, we're going to more or less, like, as reps are going to go up, load's going to have to come down, and they're going to intersect somewhere. And then we're there for a period of time. It's not a permanent change. Sometimes it actually does become a permanent change, because some of these guys go, holy crap, like I feel so much better.
Yeah.
I feel so much better in these positions.
Well, just off
but
the
like-
back of that, sorry
There you
to cut you off. Like, if you're consistently training in, let's say, the 6 to 8 rep range, and you're strong, those loads are going to be quite high.
Yeah.
So your nervous system is going to be consistently fried.
Yeah, you need to recover well.
And if you all of a sudden change, let's say, the 12 to 15, yes, the set or the rep volume goes up. Maybe the total volume stays relatively close, but just the fact that you're not putting so much strain through your body consistently, it might just give your nervous system a rest.
Yeah, and like, but that's what it is, right? And it's like I explain it as like, we're not throwing the baby out with the bathwater. We can get back to that eventually. You want to continue training. This is how we're going to continue training. You're not going to lose gains, because the total tonnage, whatever the case may be, is going to still be there. You're not going to go backwards, because you are still lifting something. This is how we're going to do it. You might catch a bit more of a pump. You tell a dude that, or especially around like their back or their shoulders, like they're going to be like,
that's good buy-in.
Sick. Like, I'm going to get more of a pump. Fantastic. So around loading and stuff like that, that's what I would be really, really cautious of, is like, I'm not going to deload you entirely. I'm going to find other ways to keep that in.
Yeah.
And then have pain caps. Like, rather than RPE caps, it's a pain cap. So if you're, and I do this with pretty much everyone who comes in with a lifting injury, is like, you're no longer lifting to an RPE. Like, while we're rehabbing, while we're doing rehab, while we're turning all these things over, you're not lifting to an RPE. You might actually have to go to like, a 3 RIR, 4 RIR, but your pain cap happens first.
Yeah.
So if you get pain on rep 4, that's done, man. Like, that's done. Like, sorry, rack it and give feedback, because that's going to change and alter our decision making moving forwards.
Yeah.
That's probably the big one that I play with. The other one, like you mentioned, like with equipment, things like that, or like exercise selection. Some people are bigger than others. Some people are smaller than others. So some people fit machines better than others. In my experience, and like I've learned this the hard way a few times, is like sometimes the best intention of putting someone, say, on a pin-loaded chest press actually makes their pain worse in their shoulder, because of the way that the hammer strength in particular, because it's the one in everything, the way it's actually designed. I then put the same person on a incline dumbbell bench with a neutral grip.
All of a sudden,
money.
Yeah.
Zero pain. Like, massive pain there in a hammer strength chest press. Zero pain, like in a neutral kind of position there, semi-pronated position there. you have to be able to like kind of play around with those kinds of things. It doesn't necessarily mean that the machine's worse. It just means that for his body shape, his body type, it just wasn't the right thing. It's the right tool at the right time for the right person. Always. And it's like sometimes there is a bit of kind of just you've got to play around, you've got to find out. But like that also then leads into, does that pain in that position, for example, here, does that mean that he's still got tissue damage? Probably not. Just means that the machine was pretty shit for him, to be honest.
Yeah.
Because pain doesn't always, as the definition says, it doesn't always mean that there's damage to tissue.
Yeah.
Like there are tests that we do as physios, like special tests, diagnostic tests that like can help elicit some of an understanding of that, whether or not there is tissue damage. But then, there's also treatment tools. Like I try needle a lot, this. And
we left needles in the gym for this reason.
Yeah. But like that doesn't necessarily mean that it's just a treatment tool. It's also a diagnostic tool. It tells me, one, if I'm on the right track with my like provisional diagnosis, but then I can also retest and see where we're at. And, is this something that is a tissue damage kind of thing? Like, do you still have like all of that weakness and loss of power, or has things started to improve? If things have started to improve, all of a sudden there's not as much tissue damage. And, you even talked about like the kind of like the fear avoidance or the fear factor. You and I have had repeated back issues over the years of lifting. There are moments like I will always still to this day go to absolute worst case scenario when my back flares up. Absolute worst case scenario. Ever since the moment where I felt my back unzip when I was deadlifting, when I was powerlifting, ever since then, every time I feel, it doesn't even have to be the same kind of pain. Anytime I feel something in my back, I'm like, here she goes.
Yeah,
here she goes.
We're on that track.
Yeah, we're on that track. So like that does play a lot of, especially in people who don't quite fully understand the implications. Even like I understand the implications. I understand what's going on, and I still don't have the ability to remove myself emotionally.
Yeah.
Because it's an emotional experience. Like no one wants to be in pain. No one enjoys that.
No.
And like that injury history can play a factor even in an acute injury of working out, where things go from there.
Yeah, for sure. And then what do you say to someone that's like has an injury or pain and they're trying to progress and they go, I'll go get imaging done?
It depends. It really does depend. With a lot of my youth athletes, if they're in competition in particular and, they just want to know and they're playing reps and things like that, or even if they're not playing reps and like the parents just go, like, we just need to know. We don't have time to wait.
Yeah.
Let's go get it done. Or if I'm suspecting something serious, like if I'm suspecting an ACL, if I'm suspecting a meniscus, something along those lines.
Like you've put all those things in place, nothing seems to be working. It's like, all right, let's go.
Or it's the initial consult and I felt like I had my knee twisted up underneath me in a tackle. I got, hip dropped, something like that. I couldn't walk. I've been feeling clicking, locking, catching. All right, let's just go get an MRI. Let's just go get an MRI because
don't waste any time.
We're not wasting any time. We get that done. You get the MRI back within 24, 48 hours. I've got you hopefully with an ortho by the end of the week, right?
Yeah.
Get it done quick. We're still going to treat you, and we're still going to have to keep managing this. But if that's the worst case scenario, best case scenario, okay, like you're lucky. You got a low grade MCL strain, no operation, a couple of weeks on the sidelines, 3 to 4 weeks on the sidelines, tape it up as you go in, get muscles back online, we're good to go. But for those kinds of things, it's great. The time that I'm hesitant about it and hesitant about scanning things is if it's not going to change my treatment, especially in the early stages. If I use imaging right off the bat with everyone, first and foremost, it's probably unnecessary expense.
Yeah.
It also may not change my treatment plan.
No.
Like it's going to give me an ego boost of confirmation, maybe. But like it's not necessarily going to change the treatment, not change how I progress things, not change my thought process.
Yeah.
I'm probably hesitant to do it. I'll give it to, and I'll present it to every patient as an option. Say, hey, like if this doesn't progress in the next 3 to 4 weeks, we can look at it.
But you're doing things over the first.
I'm still doing things over those first few weeks to like almost like just break down the clinical picture and remove possibilities.
Yeah. Yeah. It's kind of the same with me. Like someone has an injury or they come in and something may have happened over the weekend, and why I try and turn them away from completely stopping. Because obviously depending on the nature of what they're feeling. If they completely stop, they take a couple of weeks off, they might start to lose confidence in themselves again to their training plan and whatnot. So then it's like they've lost that confidence. When they come back to the gym, they're hesitant to train. So like, I need more time off. So stopping can actually make things a lot worse, especially on the terms that there might be even more pain when you come back from doing nothing. So using, movement as medicine, figuring out what type of movements we can use to make sure that their training doesn't stagnate, doesn't go backwards. And like I said before, sometimes taking 2 steps back can mean you can take 5 steps forward.
Sometimes it's not even a step back. Sometimes it's a step sideways.
And lateral, yeah.
It's a step sideways.
And using that as an example, like let's say, where squats are a movement that we're using and all of a sudden the person's got pain. It's like, okay, if we change that to a box squat, does the pain go away? Yes. Fantastic. We're just going to run box squats, maybe to different heights. Maybe we start higher, we progress down until you're getting back to below parallel. All right, sweet. How's that? Same thing with lower back. If the lower back's hurting doing deadlifts off the ground, if we put a box, we increase height, maybe we do rack pulls, maybe we change to RDLs, maybe we go dumbbells, maybe we go beast. Like so many variations that you can think of off the bat. And it might take 2 or 3 weeks to find the variation that works best. And then it's like, okay, now that we've found that variation, we can continue progressing. We can continue loading the muscles that we're trying to load. Same thing that you mentioned before, changing angles.
Yeah.
Shoulder pressing with more of a pronated grip, elbows a bit wider in that scaption plane. Maybe we go to more of a neutral grip, elbows tucked in. Maybe we shorten the range. I have my hand set behind the person.
Yep.
I don't want you going past 90 degrees. No, it's not ideal.
Floor press, pin press,
But
block press.
Could even be, okay, doing 3 overhead movements in the week is causing a lot of shoulder pain. Can we do 1?
Yeah, or 2.
Right? How much can we change the load? Can we reduce the entire volume? And then actually looking at how much load we're putting through those, because depending on the program, it's like you might have a lot of load going through your lower back without doing anything like specifically hinge related or squatting related. You might have bent over rows in your program. You might have some sort of variation of a good morning or a hinge. They come back to back and it's like, okay, there's a lot of load going through our lower back. Maybe we look to go into something different, drop the load down that is completely isolated into the lower back. And then even looking at things like, we've spoken about this on previous podcasts, lateral flexion, rotation,
different ranges of motion,
anti-flexion, like doing all these different things, which like might force the muscles or the areas that we're feeling pain to work in a different way.
Yeah.
And it's like, okay, now we don't have that pain. So the goal should never be zero pain, but looking at something that's very predictable and manageable, if we can come into a session and go, okay, we can still get through the exact thing that we need, but avoid being at a 7 out of 10 pain, but we go to a 3 out of 10. Obviously, we've used it on you, we've used it on me. I've got clients that use it, but the Newbie is a great, great tool that really helps, especially when it comes to pain. Figuring out exactly where the body is neurologically triggering, getting pads on those areas, being able to stimulate those areas without having to put mass loads through it. The Newbie is a great tool to help still stimulate, still train, avoid pain, but also on a neurological level, teach the brain that part of the body is no longer in danger. One of the great analogies that I like to use, especially when it comes to the Newbie in retraining the way the brain works or send signals to the muscle, especially to if the injury or the pain has occurred or still occurring months after there was potential soft tissue damage, is the brain, obviously, when it sends a signal to the muscle, thinking of it like a hose, right? So you turn the tap on, water flows through the hose, gets to the point where it needs to go with no drama. Sometimes when if it's a neurological thing, that hose can be kinked. So the signal doesn't get to the area it needs to get to efficiently. So the hose is dripping instead of water flowing. Getting the Newbie on where that kink is, and sometimes it could be right on the point. Sometimes it could be miles away. Elbow pain when doing a movement, you think it could be stemming bicep, tricep, forearm, where it could be coming from the shoulder.
Could be coming from the neck.
Right? So you find out where it's coming from. All of a sudden you unkink that hose and it's like, oh, well, my pain disappeared. right? I've had people that, incline bench pressing, no matter what they do, they warm up, no matter how they train, they just got this constant niggle in their pec, constant niggle in their shoulder. One session on the newbie, I get a message saying, hey, I just PB'd my lift by 10 kilos and I barely had to do anything different in like the standard warm up.
Yeah.
And it's like, okay, obviously the newbie does help with that, but it's also understanding how to use it.
I think this is where it comes into, again, that definition, right? Like it's a sensory and emotional experience. All you're talking about with that is the same thing we're talking about with maybe more traditional treatment tools, where we're looking at like soft tissue release, we're looking at dry needling, we're looking at all those kinds of things, where it's adjusting and modulating the central nervous system and the brain's perception.
Yeah. And that's, at the end of the day, that's what pain is, right?
And that's really what we're doing. And I think like, if we're looking at it from that perspective and we're looking at it as not just, I have pain, I've torn a muscle, then I guess we've got a bit of a checklist that we need to run through to like have a little bit of like, not really like an audit, but like just a decision-making process. Like you get up in the morning, say you and I are going to train Monday morning, right? Like just an example. One of us wakes up pretty bad. Like, do you have any like checklists, even for your clients, right? Your client comes in and we know one of them, Matty, big old Matty. If he comes in Monday morning, because I know you train in Monday mornings, and he goes, my back's really sore. Like, are there any questions you ask him?
Yeah, so I'll kind of okay, like with the pain that you're experiencing, is it changing how you move? Right? So if he comes in and I can see he's twisting and he's walking funny, okay, yes, it's clearly changing how you move, right? If he comes in and he's like, it just feels really stiff. Okay, well, maybe we can look at going a slightly different warm-up to that session. Maybe we can look at seeing how he progresses when there's a bit of blood in the area. We also train super early in the morning, so let's see what happens when you wake up and your body temperature starts to rise a little bit. So that could be something. Obviously, I check in after every set. Is the pain getting worse? Is the pain getting better? If it's getting worse, it leads down one path. If it's getting better, we kind of can continue on the same trajectory. Obviously, checking in the next day.
Yep.
So let's say, for argument's sake, we do more of an upper body based session and he was having the lower back pain beforehand. It's like, then following day, it's like, how's your back feeling today? Does it feel worse? Does it feel better? Maybe he had a better sleep. Maybe he had better nutrition. Maybe he was better hydration. Maybe his stress has gone down. Or he might say, no, it feels worse today. And then we've got legs on Wednesday. It's like, okay, we need to monitor what we're doing. And then, that following Monday is, how does your back pain feel today? Did something happen over? I think one thing I missed as well, what did you do on the weekend?
Yeah.
Like, did something happen over the weekend?
Was there
did you go do an extreme sport? Did you have a night of drinking? Did you, if we're using Matt in his example, but for someone maybe that's got kids, like, were you throwing the kids around? Were they awake all weekend?
Yeah.
All those things can kind of play into that as well.
Yeah, I agree.
Yeah. That's kind of the checklist that I'll go through.
Yeah, I think like they're very similar questions to the questions that we ask in our consults as well as physios. I think like, but to give like some kind of guidelines around that, like we mentioned before earlier, like if the pain's sort of like a sub 3 or 4 out of 10, like I'm okay with carrying on through that and like just continuing to assess where we're at.
Yeah.
And warming up and taking all those necessary steps, like, with those precautions. But I'm always like, when I'm talking about like, especially with, am I querying, is this just soreness or is this an injury? If pain gets worse, like we need to modify something. We need to address that, whatever it might be, whether it's, changing the movement, moving on from that movement for that day or something like that. We need to modify some part of the session or some part of the training program to give the body some time.
Yeah.
Firstly, and also like see if we can modulate that with a different movement pattern, maybe an isometric or something like that.
And even with the if the pain's escalating or is it lingering, whatnot, it's not getting better. Maybe you also have to look at going, okay, for the next couple of weeks, maybe instead of doing 3 lower body sessions, I do 2.
Yeah, 100%.
Right, like
drop a session or
start managing that load a little bit more, and actually give the body a chance to recover and repair.
For others, like I might look at it this way and I might not change the number of sessions. I might just change the number of sets.
Yeah.
So if I've got a bodybuilder who wants to do 4 sets on everything, okay, firstly, I'm looking at that going, that's a lot of work. if I'm doing 4 sets of everything, I might drop them to 3 sets. If that's or like negotiate, ideally I'd negotiate them down to 2 sets on everything. Just do 2 sets of everything. You're probably going to halve your training time. You're probably going to feel okay. Like maybe not initially because you're going to be like kind of messing with your head a bit,
Yeah.
but you'll feel okay. You will get better.
Yeah.
Because like, you know, like training in particular, like the reason I do that and the reason I think about it that way is because like we've both trained through pain.
Yeah,
and
100%.
there's
Doing it
nothing
at the moment.
Yeah, but like training through and training around 2 different things, right? Like training through pain and trying to be hardcore about it, like you're not a hero.
No, you're just going to end up, you're going to make yourself worse. And using that as a prime example, as we wrap this up, like I've been having, you know, a little bit of knee pain coming out of the bottom of the hack squat lately. Now I love the hack squat, but it was like 3 weeks ago, I just significantly dropped the amount of weight I was doing, focused more on warming up through my quads pre-session. So I moved my leg extensions from the end of the session to the start of the session, warmed up better, did a bit of mobility work, started probably 50% lighter, and then every week just slowly progressed that weight up. I'm back doing the weight I was doing probably 2 months, like the last time I had hack squats in my program. I'm back doing the same weight, the same reps, and no pain again. So it's like,
Took you 4 weeks.
it took me 4 weeks.
Yeah, like 4 weeks, and you haven't necessarily stopped training
No,
in that time.
I
So you
kept training. I
you
kept
haven't
training
necessarily
through.
gone backwards.
But it was also one of those things where like the knee pain was mainly in the hack squat, right? Now the pain was there in the hack squat, the pain was there in the pendulum. So I was like, okay, if I'm using that squat variation, I'm going to stick to the hack squat. I'm just going to find the load that doesn't hurt it anymore and just slowly progress through it. A lot of my other lifts, so lunging, that wasn't hurting. So I kept my lunging, that volume, that intensity,
You only
all the same.
one thing you didn't throw
The leg
in.
extension wasn't hurting. The volume in that stayed the same. RDLs, they felt fine. We changed that because of a bit of lower back issues, stem back. So we changed the loading parameters on that. That feels fine. Done a few sessions on the newbie, felt great. So it's like, and now I'm back, no pain, back to the weight I was lifting. Took 4 weeks. I wasn't trying to be a hero and be like, I have to do the weight.
No.
Because I can't afford to have bad knees.
Or a bad back, more so than it already is.
Yeah.
You got 2 kids and you've got a job. But like, I think on that note as well, like if you hadn't been able to change any of that, like you're not going to just be a hero. You're not just going to do it yourself and like, just go, oh yeah, like, you know, like you'll get to a point where it's like, all right, Josh, like I need you to assess it or, you know, go see one of the other guys. Right. Like, and I think that's the key thing. Like if you're genuinely in, like if you are genuinely in fear, it's okay to go get assessed.
100%.
It's okay to talk to a physio. Hopefully you find a good one. Please find a good one. Please don't listen to someone who says you're never going to lift again.
No.
Or
Been
you
there,
should stop
done that.
lifting. Yeah, been there, done that. I've been there, done that before I was a physio. So like don't be that. Like pain doesn't necessarily mean you're broken.
No.
It just means that your body is adapting to something or has adapted to something in a not necessarily a good way.
It could even be just trying to tell you something. Like
It's a warning light. It's a warning sign.
Yeah.
That's all. And it's a sweeping comment. It's just big generalization, but stopping isn't always the best option.
No.
Stopping everything is not always
stopping
really the
no,
best
no,
option.
Never.
9 times out of 10, there's always something you can do.
do.
Whether it's a deload, whether it's, you know, rehab, whether it's changing exercise selection or changing exercise order, there's something you can do at all times.
Definitely. I agree.
There's a lot more to pain than we've talked about.
Oh, yeah.
And like I've been a physio now at 6 and a bit years, studied for the better part of 6 years to be a physio. And I still don't fully understand it. Like 12 years of my life, like I'm nearly 31 and 12 years of my life has been the science of all of this.
Yeah.
And I still have absolutely no idea. And I'll probably never know it.
And I think there's so much more around pain that consistently comes out.
Yeah. Oh, like almost on a daily basis, there's a new paper that comes out. I can't keep up.
Yeah.
Again, like I'm not saying that you need to be on top of all the research because, you know, it's really hard to be. And it's also then being able to discern what research is applicable and not. But there's so much to it. And I think like having a broad idea of some of these guidelines around like when to train around it, when to not train around it, when to get assessed, when not to get assessed, are probably they're the most important things.
And sometimes you might just need a massage.
Sometimes
Go get a massage. get
Yeah,
an extra
well,
night's sleep. Like,
sometimes you just need to go to bed an extra hour early.
yeah,
that
sometimes it
night,
could
so
be the most simple thing can make all the difference in the world.
drink more water or something like that.
Yeah.
You know, like that those things are valid options too. But I think that's pain.
I like it.
That's pain in sub 40 minutes.
I like it. Yeah, pretty much.
Hey.
And guys, if you do have any questions around pain or things like that, send us a message. I'm sure we'd be happy to have deeper chats for more personal related, because I think Josh maybe a little bit more than I did, but it depends. A lot of the time, pain or injuries or niggles or what to do, there are so many factors that you can't just give a straightforward answer. So it will depend a lot of the time. So if you are struggling with any pain or niggles or anything along those lines, send us a message, and we'll be happy to get back to you. If you see us around the gym as well, just grab us if we're not busy and say, hey, I've been having this little niggle. Like, what do you think it might be? This is what's been going on. And we'll be happy to answer it for you.
Grab him around the gym if I've got my headphones.
Yeah.
Don't talk to me. I'm there training.
Okay, so yeah, if you see me around the gym, grab me.
Yeah.
I just refer out to Josh anyway.
And then he'll send
my way the message. I just send him the message. Right?
Yeah. That wraps us up.
That's another one.
You want to run through our sponsor?
I don't remember. Sponsors. We got a new one.
Sorry, we got another.
Oh, I've got another one. We're flying here.
You're doing the sponsorships then, because I don't know.
So again, another shout.
Tom's the partnerships officer over here.
The Catalyst Brewing Specialty Coffee. Again, if you're buying online, use code Dom and Josh to get 20% off your coffee orders. And anyone out there that's looking for a plumber, I know this is a random one. We got a plumber on board. Okay.
Who knew a fitness podcast could have a plumber as a sponsor?
All right, we'll put their link onto the show notes. Okay, but Precision Plumbing and Maintenance. I know it's a bit of a mouthful. Precision Plumbing and Maintenance. We'll put their contacts into the show notes. So if you are looking for a plumber, they're good. I actually fixed my toilet the other day. Having a leaky toilet.
Say, did you bomb it, or like, what was the go here? Did you bomb it?
No, this wasn't that. All right. So
poisoning in the house?
No.
No, very good. Because I'm sharing a podcast studio with you at the moment. I don't want that.
No, we're good. We're all good. It was just house is a little bit old, few plumbing issues, but came through, fixed them. Happy days.
Always need a good plumber.
Always need a good plumber. All right. All right, guys. That's another show wrapped up. Enjoy yourselves. Peace.
See you in the next one.